Smooth 98.1, love music, love life. This is the Smooth Drive on a throwback Thursday evening, 21 minutes past 5 p.m. Yours truly, Ayokunmi down to talk with you about your health. This is Smooth Health on the Drive. And this evening, we're going to be talking about hepatitis. Now, this is something that needs to be spoken about on a regular. It is something that we as humans and Nigerians grapple with, and we you don't always bring it to the forefront when we talk about a number of ailments. Now, when we talk about hepatitis, it is an inflammation of the liver, commonly caused by viral infections. And there are five main types of hepatitis. There's hepatitis A to E, but there are a lot more than that. And this is why we're here to have this conversation with my very special guest in the person of Dr. Emeka Nwune. He is a medical doctor, a philanthropist, as well, the CEO of Swift Medics Healthcare. Very good evening to you, Dr. Emeka. Welcome back to.
Good evening, my brother. Good evening. I'm so glad to be here once again. It's been a while, and I'm always excited to come on board to share my knowledge and advise the people listening. So thank you so much for having me.
All right. Thank you so much for making out the time, because I know you doctors, you are so busy. You have so many things to do. And whenever we can get you on the show, it's an absolute pleasure. We just want to get all the best that we can from the conversation. And talking about the conversation to all our wonderful listeners out there, you can join us on WhatsApp. Any questions that you might have concerning this particular discussion we'll be having, you can do that on WhatsApp. The number is 0809 440 981. 0809 440 981. That is the WhatsApp number. You can also join the live stream on YouTube at Smooth 981 FM Lagos. All right, Dr. Mika, let's get into it and start from the beginning. I gave a brief introduction as to what hepatitis is, but could you do more of a deep dive on it and explain the different types, at least the first five, A to E, that I actually referenced at the beginning?
Absolutely. All right, thank you very much. Hepatitis is a serious problem. It's like you rightly said, it's an inflammation of our liver that is usually caused by, viral origin or possibly other causes. But what is the liver? The liver basically is a large organ that is located like in our abdomen. If you look towards the right side, below, in the middle area of your abdomen, just on the right side, that's where your liver is. And normally the liver has a lot of functions. The fact that we take substances in our body that can potentially be toxic, the liver's function to detoxify everything we take in our body, making it harmless to our body. We're talking of alcohol, we're talking of toxins, we're talking of everything. Your liver also does a lot of functions. It produces like some enzymes that help in breakdown of foods like fats, proteins, and carbohydrates. It also stores some nutrients like glycogen, vitamins, and minerals. So the liver basically helps our blood to stay pure. Also like helps in removing waste products like what we call bilirubin. It's like is a substance that is formed from when red blood cells break down, and also removes cholesterol from our body. So that means if there's any issue with the liver, all these functions like breaking down cholesterols, excreting drugs, excreting like the bad products, and breakdown of foods, all these things I mentioned. If there's any issue with the body won't be able to perform all these functions. So straight into it, hepatitis is an inflammation of the liver. There are different types. We have the A to E. So there are some that are more severe than the others. The hepatitis A and the hepatitis E, they are usually gotten through similar routes, which is what medically we call it fecal oral routes. That's like, from contaminated foods and drinks, from, bad hygiene. And this food can, this virus can be present in these foods that we take, and due to poor hygiene, we take into our body, and it causes these problems. Well, the thing with the hepatitis A and the E is that it's not that severe. Like people that have this form of hepatitis,
compared to the other ones.
yeah, their body is able to like fight back and resolve the issue without them having to go through more extreme or complications, right? But now just and for the E is usually food and water, but for the A rather, hepatitis A, but for the E is mostly like contaminated water. So that's the difference. So the A has it can be like both in the food and water, but the E is mostly just water. Then we're talking about the B and the C. These are like the ones that are more severe. You know, they can be transmitted through like infected blood, from an infected person to an uninfected person, which can possibly be through an open wound, like where people are sharing like sharp objects,
Mm.
you know, where maybe some foreign object that has the virus on it in the open space, like rusted nails or all those kind of things. Um, because hepatitis can really last, the virus can last in the environment even stronger than HIV, so it
No
can last
way.
for, yeah, and it needs like high temperatures to be able to kill that virus, which is why, medically, when they're doing any surgery, they have to like screen you and, do hepatitis screening to be sure that you're certified. And they have to like, also like even when you're donating blood as well, they have to screen you and be sure. Even during surgery, they have to like use the autoclave to sterilize the surgical instruments, which is why it's not advised to like share clippers and sharp objects, because you don't know who is who. It's better to have
Mm.
your own personal items. Even people that braid their hair or do manicure or pedicure, as the case may be. So these are the ways hepatitis B can be transmitted. Apart from that, also through intercourse from an infected person to an uninfected person, through
Okay.
transfer of like body fluids. It could be like the semen or the female one as well, the female fluids during intercourse. And, or also from mother to child during birth, if like proper precautions are not taken. So usually, like if a mother has hepatitis B, the precautions she's meant to take to have safe delivery where the baby can come out safe. And even when a man or a woman has hepatitis, there's a way you can like, really reduce um the viral load, which we're going to get there
Mm.
though. But there's a way we can
Mm.
reduce it without getting your partners infected. So basically, C and B are transmitted through these ways I mentioned: intercourse from an infected person to an uninfected person, through
Okay.
sharing sharp surgical instruments, and childbirth. The difference between B and C is that B hepatitis B has a vaccine, um, while hepatitis C currently has no vaccine. Another
Okay.
difference is that hepatitis B can further complicate into what we call hepatitis D,
Ah,
and so D cannot exist without hepatitis
without
B,
B.
basically.
Okay.
Yes. So D doesn't exist except someone has a B and now further complicates to what we have a D, which is very chronic, and yeah. So these are the different types of hepatitis, and yeah, the main way is to stay protected, and I'm sure further down we can expatiate more.
Mm, definitely. And now you actually mentioned that hepatitis B has a vaccine, but there seems to be a high prevalence of that particular type of hepatitis in Nigeria. Why exactly is that? If there's a vaccine, you think that the prevalence would be much lower, but it's the opposite. What's going on?
I think it's just really lack of awareness and maybe inadequate vaccine coverage. So many people don't really know about the mother to child when they think, okay, it's just through sex. Okay, true. But what about, are they being protected from mother to child? Is there that education? During the antenatal, are they giving them this information? I think we just need more public health awareness about hepatitis B. Maybe expand the vaccination programs, for even for newborns and people living with high risk, and maybe we can promote safe injection practices and blood transfusion, promote safe sexual practices, maybe people can like share condoms and contraceptives, and just, campus awareness, because these are the people that are really active in this thing, these younger ones. So I
Right.
feel like we really neglect the younger ones and be like, oh, we're just talking to older people. Older people, most times, they are even safe. So I believe like, we need to like really figure out who are we sharing this awareness to, and yeah, and just I think more awareness, more awareness, and
More
yeah.
awareness. All right, all right. Thank you for that, Dr. Emeka. We'll talk more about the vaccines and, of course, what to look out for in terms of knowing if a person has contracted hepatitis and so on and so forth. All that and a whole lot more on the other side of this quick breather right here on Smooth Health on Smooth 98.1. Don't go anywhere. Okay, quick 2-minute break and then we'll jump back in.
Awesome, awesome. It's going so nice.
Yeah, it is. It is.
Yeah. But hepatitis is actually a serious problem.
Yeah, and it's just surprising that it doesn't get talked about that often. You hear, okay, you hear HIV, gonorrhea, and some other,
Yeah,
STDs and all that. But when it comes to hepatitis, which can also be contracted in a similar fashion, you hardly ever hear it talked about
right.
like that, which is so weird.
It's weird. It's so weird because like I feel that to be honest, people just look for where the money is at. You know that if you're talking about HIV, you'll get funding from Bill and Melinda Gates. Maybe if you're talking about hepatitis, maybe Bill and Melinda Gates is not so interested. I don't even know. But it's just like all played out and washed out.
It's just sad. I mean, it's just to keep on making noise about it. That's the important thing. Just keep on making noise.
Yeah.
Let me get water quickly. Text the code to 8011 and fill the prompts to stand a chance to win any of these instant prizes. Promo valid from July till December. Terms and conditions apply. Get extra value on the North of Brown and Green Pack. More. Eat for good. After a long day. Now, this kind of experience, we honestly give you our premium water heaters. Now, don't get with better materials. The technology where they take make them will always guarantee say you go get hot water when you need them. Invest for your comfort as you save money on billings. Upgrade your home with Ariston water heater today. For more information, visit our website at www.ariston.com or follow Ariston on Facebook. This is Smooth Health on the Drive. This is Smooth Health on the Drive. Welcome back to Smooth Health on the Drive on Smooth 98.1. Love music, love life. It is 34 minutes past 5 p.m. It's a nice, cool Thursday evening. My name is Ayokunmi. I'm talking about your health issues and, of course, not your health issues, but health issues with you. I beg your pardon. I'm not saying you have any health issues and all that, but this is where we get to have those conversations, bring them to the fore, get the awareness out there, which is part of what we're doing today, because we're having a conversation about hepatitis. And we being me and my special guest, Dr. Emeka Nwune. He is a medical doctor. He's a philanthropist as well, the CEO of Swift Medics Healthcare. Welcome back to the show, Dr. Emeka. I mean, looking at this conversation thus far, at some point I've had my mouth open in wonder that this is such a serious issue, but we don't hear it get drummed up as much. And we've spoken about different types of hepatitis and also the fact that there is a vaccine for it. But I guess due to the lack of awareness thereof and maybe the should I say the inadequacy of the vaccine going around could be part of the issues here. But let's talk about what one should actually look out for in terms of recognizing hepatitis, different types of hepatitis. What should someone take note of? Oh, I can see this is going on. This could be hepatitis, and so on and so forth. What are those symptoms that are at least visible for us to see?
Okay, that's a very good one. So like the thing about hepatitis is when after a person has been exposed to the virus, sometimes it usually takes like a window period of about we'll say like 45 days before the person can test positive on test results. That means like within that period, like person might be infected but not showing the result, So sometimes people might have been exposed and do a quick test to just check, oh, do I have the virus? Doesn't mean that, as they checked it and the result comes out negative, doesn't mean that they don't have it. So it means like at that
Huh.
time, okay, they know that they are screened or they are freed, but they should check it like really after that window period said, after they have also like, done all the post exposure protocols that are available, which
Okay.
basically means like just like steps that you take. So after you've been potentially exposed to this virus through maybe intercourse or um, from wounds or from an infected person through sharp objects or as earlier mentioned, yeah. So but when we now talk about like people having the symptoms, it means like it's more advanced. Sometimes people find it incidentally from their results, from routine screenings. That means they might have not even had any symptom in years, and they just did a test
Oh,
and they see that they
wow.
have it.
In years.
Yeah, yeah, it's possible. And they just see that they have hepatitis, and they're like, "Wow, from where?" You understand, and they begin to panic. So usually, when the people start seeing symptoms, they're talking about them feeling tired. They've done malaria tests, done this one, and they're just feeling tired, feeling feverish. Losing appetite, maybe unexplained weight loss. Sometimes all these symptoms are not even typical to just hepatitis. Some other
Right.
diseases have similar patterns, which is why for you to recognize this, you must have asked the person like professionally, gotten a proper medical history and known all the possible risk exposure. Asked him, have you had this? Have you been exposed to this? Has this happened? Have you used sharp objects? Did you do surgery? Did you receive blood? All those kind of questions just to, you have to get a proper history. So it's not just one, when the person has all these symptoms, you say, hepatitis, and you be scared, and they could have like abdominal pain, which the pain can be anywhere in the abdomen, but most times it will focus on that angle like I explained to you where the liver is located, like in the right lower abdomen, just like below that, the arc of that your rib, from the middle
Okay.
to
On the right
the lower,
side.
yeah, on the right side, but in front, from the
Okay.
arc of that your rib down to the below. So that's where the person gets to feel the pain most times. Then they could possibly have like urine that will be dark colored, like as dark as like proper black, like Coca-Cola. That's what we usually call it in medical school. Their
Wow.
stool be like pale, like whitish. You see like chalk color, like their stool will be white. So they could have like yellowness in their eyes. So sometimes they could
Mm.
have one, two of this, or they could have even none of this. So, but usually, like these are the things that people that have, or they can even have like some. Actually, the abdominal pain can be so severe that when you touch the abdomen, like you see it swollen. Like even small touch is paining the person. That's like a more advanced stage, or
Okay.
they can have
Okay.
like more complications where they have like swelling on their legs or like swelling in their abdomen, like the liver is not functioning properly. And anytime the
At
liver
that
is not
point.
functioning, it even gives the body like risk of having like a kidney failure as well. So, there's something we now
Mm.
call the liver and the kidney, like the failure syndrome. It's like a chain of symptoms that happen when, all this happens because the liver is meant to help us clean up our blood, make our blood clean
Right. Right.
to
Right.
detoxify, but it's not able to do all this. So it's accumulating all the waste, and all the waste potentially, if not treated on time, it starts to cause problems, and person starts getting infections. Then all this can now like, possibly slip into the brain, now causing like brain problems as well. And once it gets into that brain problem, it now gets more it's very, very hard to even reverse. And we're also talking
Mm.
about other complications like liver cancer being a possible complication if the treatment is not adhered to or the person is just neglecting. So I think all of this can be avoided by doing early knowing what to do, doing early checks, doing regular
Early
checks is
checks and
very, very
screenings.
important. Every 6 months, just check your viral markers, hepatitis B, C, HIV, syphilis. Just to know is important. That's which is why people also recommend it doing job employments and schools, during admission,
Mm.
in church, before you get married, before you donate blood. So we do this regularly. But it's just that sometimes, people don't know the details or the implications of what they're doing. They're just like, okay, I've done the test. Okay. They don't really like care. But when we're spreading this kind of information and letting them know how important knowing your status is, it protects you and protects your partner. You're not putting the world at risk. We're reducing
Okay.
like the disease. We're not stigmatizing people because we understand how it came about. It's not everyone that is true intercourse, and you'd be like, oh, this person is unfaithful. Or no, some people might have been true
Exactly,
schedule.
exactly,
So,
exactly. That is very
we
important.
to where, yeah.
Okay. Okay, now this is a two-in-one question right here. We spoke about the vaccines earlier on. Now, I actually really need to know how effective are these vaccines, number one. Number two, who exactly should get vaccinated? That's on one hand. And can you discuss the current state of hepatitis treatment options that we have in Nigeria right now?
Okay, so for the vaccine, I think the vaccines are usually highly effective. Because usually, normally during like our normal Nigerian program for immunization, the NPI schedule for immunization in Nigeria is even there for like hepatitis, you know. So children usually are given the hepatitis A as well as sometimes they're given like the starter doses of B. But if they're not given during that early time, they can also it's also recommended to take any time they just ask them if they've not gotten it there. They can get it at any time in their lives. First they just have to do a hepatitis screening, and on the
Okay.
negative screening, they know that okay, they're negative and they can go ahead to receive the vaccine. So there's for hepatitis A and there's for hepatitis V. B vaccine is also recommended for like more for like health workers. You're always exposed to like sharp needles and
Mm.
uh,
And
people
fluids
that
and all that.
yes, exactly in surgery during taking samples, injections, during everything. Um, and also people that maybe have multiple sexual partners. It's very highly recommended because it can be gotten through these ways. Then also people that maybe had drug users or something that they had to inject themselves. And other people are high risk. Maybe people that their partners maybe have hepatitis. It would be good for them to stay vaccinated. People that let me see what else. Um, I mean, even people that have other forms of diseases, like if somebody has HIV, I think I would definitely encourage them to stay vaccinated against hepatitis, you
Okay,
know,
okay, okay.
or maybe people that even got raped
At some
or the
point,
parents.
just to be on the
Maybe
safe side.
maybe even if not at some point, like maybe for instance, someone reports to you that or like they rush you someone in that this person just got assaulted. Please, what can we do? So I mean, part of the recommended tests for sure, you have to like screen the person to know if the person has hepatitis. That if it's negative, you vaccinate them immediately. You know, um,
All right. All right,
yeah.
good to know, man. The time has absolutely flown by. But before I actually let you go this evening, what advice would you give to individuals who are diagnosed with hepatitis in order to manage their condition and also prevent transmission to other people?
I think it's very important, like to like I said, to know your status, and for those that find out that they have hepatitis, I would advise you should you should see a doctor in a hospital. You go to a recognized hospital and see a doctor. If possible, see a counselor
Okay.
in the hospital that can also break it down to you because sometimes the doctors might break it down to you, but if you need more information, they will definitely be able to refer you to like people in departments in the hospital
Right.
where they can take their time and enlightening you, and they'll build like communities with you and let you know that you're not alone and this is a curable infection. I remember even my early days in the hospital, I used to see a lot of hepatitis patients in clinics, and they were very nice. Like everybody, you wouldn't even notice anything is wrong with them if they don't tell you.
Mm,
So like there are a lot of people out there that they look normal and they might be going through stuff. So I feel like um, just give them the support they require, and
Very
yeah,
important.
find out
Empathy is key.
it's very key. When you see a doctor and they recommend drugs for you, take your medications religiously. Sometimes people feel like, oh, I feel much better. I feel so fine now, and they
That
neglect
happens
their,
so many times.
you
So
know,
many
uh,
times.
and most times when they come back, they even need a higher dose, and they're even like, so it's just all a mess. So it's like I feel like that second chance should always be adhered to. We
Right.
shouldn't be careless patients and our treatment plans. And make sure you be open with your partners and let them know about your status. Make sure you protect people around you, make sure you use protections and advocate for the right things and just advise people um, and avoid alcohol for sure. Make sure you eat well, maintain a healthy lifestyle, exercise, make sure you do your checkup regularly and do your test in the hospital. You have to do a liver function test from time to time. They'll place you on some multivitamins as well, which you'll be taking.
Okay.
They'll advise you kind of foods to take. You have to since because liver is meant to synthesize and break down all those things I mentioned, the fats, and all of that. So
Right.
you have to reduce the fatty food you're taking, because the liver is not working as it's meant to work. So
All
you
right. All
place
right.
special diet, safe hygiene, safe sexual practices, and yeah, I think regular checkups and
Very, very
just have
important as well.
proper following your treatment plan, following your food plan, and everything will be fine.
All right. Thank you so much for that, Dr. Emeka Nwune, for sharing all this knowledge with us. Real quick before you go, for anyone who'd love to talk to you about these issues and just pick your brains more or less, where can they find you on social media specifically?
Okay, on social media you can find also on Swift Medics. That's SWIFT_medics. And I'm in Swift Medics Healthcare on LinkedIn, Facebook, and everywhere. My personal
Everywhere.
Instagram, Emeka_Nwune. That's EMEKA_NWUNE. Yeah.
All right.
Thank you so
All right.
much.
Fantastic.
This
Thank you so much for coming in. It's a pleasure talking to you as always.
always, always. So I hope to be on the next episode to let people know more about, because I feel like the main reason we're doing this is to let people make informed health decisions for themselves. We're not
That's right.
saying you must
That's
do
right.
it, so you must do that. We're just like, this is what's out there. Oh yeah, now decide for yourself. You want to live
Exactly.
a healthy life,
Exactly. Very true.
you want to stay older, you want to stay fresher, to just stay fresh and eat natural stuff and you'll be good. So we just want to
Yes.
make it
Yes. Yes.
cool, fresh guys doing this thing and not just coming from the older folks. So yeah, yeah, man. I think we should lead by example. And thank you to everyone that tuned in this evening.
Most
Such a pleasure.
definitely. All right. Thank you to all the wonderful listeners who tuned in and, of course, got one or two important things from the message we've spread on Smooth Health. We're back in on Thursday at 5:15 p.m. for another edition of Smooth Health right here on Smooth 98.1.